attitudes towards primary healthcare among healthcare workers and other relevant stakeholders in the northwest Syria. Our presenter is Ms. Sara Basha, or shall I say Dr. Sara Basha, who is a Syrian Scottish final year medical student at the University of Aberdeen. Dr. Sara has recently completed a master's in global health and management at the University of Aberdeen too, and she plans to pursue a career in the humanitarian field relating to Syria. So without further ado, please, Dr. Sara, you can join us and share.
Sorry, thank you. I'll just share my screen. Sorry. Can you see that? Is that?
Yes.
Okay, perfect. And can you hear me okay?
Yeah, perfect.
Excellent, thank you. So shall I just get started?
Yes.
Thank you. Okay, so hello. So today I'm going to be talking about the results of my study looking at perceptions and attitudes towards primary healthcare in Syria amongst healthcare workers and other relevant stakeholders. So I don't think I need to go into too much depth about the background for this event today, but we know that the conflict in Syria has destroyed infrastructure, displaced more than half of the pre-conflict population, and fragmented and politicized the health system. And as you can see from this map, Syria is now divided into 4 main geopolitical regions, each with their own governing bodies and health service providers. The northwest of Syria is the region that we were discussing primarily in these interviews, and health services there are provided mainly by non-governmental organizations. So this health system is underfunded, understaffed, and the ongoing COVID-19 pandemic has only exacerbated these issues. And so when we're looking at solutions, we want to make sure that we're able to make use of resources in the most efficient and effective way as possible. And so this is really why primary healthcare is so important in conflict settings, because it does just this. It allows us to use resources effectively to reach as many people as we possibly can. And I think that it's been used successfully in other post-conflict settings, such as Kosovo and Guatemala, but it's important to consider that any interventions that we use have to be context specific, so that we have buy-in from stakeholders to ensure that services are provided effectively and utilized effectively as well. And so looking forward towards the Sustainable Development Goals in Syria, primary healthcare is really fundamental to achieving these. However, the issue that we have is that there has been a long-standing preference for secondary healthcare in Syria. So we wanted to understand with this project what the current attitudes and perceptions of primary healthcare were amongst stakeholders, as well as what barriers exist to implementing a primary healthcare service, and how we can overcome these. And so this is a case study that used semi-structured interviews to collect data and thematic analysis to analyze that data. So we recruited participants using the following set of inclusion and exclusion criteria, and we used a 2-stage sampling process to do this. We recruited 6 participants initially through purposive sampling, and then a following 6 through snowball sampling. Our consent process involved sending out an introductory email with a participant information sheet, and allowing 5 days for any questions or discussions around the research. Following this, if participants were interested in being involved, we sent out consent forms to be signed, or we took verbal consent before interviews. So we developed our topic guide using our research question and a literature review, and we discussed this with stakeholders that we had contact with from the Syrian health system to ensure that questions were as appropriate and applicable as possible. We conducted interviews using Teams in English or Arabic, and audio recorded them using the same software. So we made use of the 5 phases of analysis that were recommended by Yin and shown here in this diagram during the data management and analysis process. In compiling the data, I transcribed verbatim and translated simultaneously all interviews where appropriate. And then in terms of disassembling and reassembling, I used open coding and took an inductive approach, as I felt this was most suitable for the research question. And as I was going through the data, breaking it down, trying to sort it into its different groups, I was trying to engage as much as possible with the 3 processes recommended by Yin to minimize bias, which are constant comparison, negative instances, and rival thinking. And then after interpreting this data and identifying some of the key themes, I discussed this with the broader research group as a form of triangulation to strengthen the analysis. So To reach saturation, we interviewed 12 participants. There was a mix of males and females ranging between 21 and 60 years of age, all of whom were working in the medical field and all of whom were Syrian. And I think this is a real strength of this study because it means that all of our participants had lived experience of the Syrian health system. So from our analysis, there was 3 key themes that we identified: the governance of the health system, community and patient perceptions, and the health workforce. Within the first key theme, we have 3 sub-themes. And in terms of inadequate communication and coordination, this was something that came up in a lot of interviews. And there was really this idea that there is very poor coordination between NGOs and local health directorates, and almost an absence of coordination between NGOs themselves. And I think this is described really nicely and eloquently by this participant who said, the health system has become made up of a mosaic of pieces that are shaped by NGOs. And this is really leading to a mismanagement of resources and discrepancies in services, which is acting against the ultimate goal of primary healthcare to achieve universal health coverage. So this takes us on to the second sub-theme, which was the power of donors. And again, this is really nicely summed up by this participant who said, who has the money has the power. And this is something that was brought up by a lot of participants. And it's this idea that funding agencies have this ultimate control over what projects are done, where they're done, who is involved, and for how long they last. And this is really leading to a lot of anxiety around job insecurity and frustration in ineffective, insufficient short-term projects. And there seemed to be this lack of control felt by a lot of the doctors in the field that could be contributing to the poor service delivery that was expressed by a lot of participants. Finally, the last sub-theme within this key theme was the lack of monitoring. And some of the participants, mainly those in managerial positions, really stressed the importance of having a quality assurance system in place, but also explained the challenges of implementing this without a governing body. And this is explained really nicely by this participant who said, who's doing the quality control? Who is doing this monitoring role, and who is playing this liability responsibility role that really can have impact on the quality and follow-up? And I think this highlights the difficulty of ensuring that these systems are in place without a unified governing body to make sure that these procedures are followed and adhered to. So the second key theme that we identified was community and patient perspectives, and within this there was 2 key sub-themes. So patients' attitudes towards primary healthcare was discussed by all participants, and there was this idea that although patients are making more use of primary healthcare after the beginning of the conflict in northwest Syria, because primary healthcare is made more accessible by NGOs in the area, not everyone is convinced by these services, and I think this is described really nicely by this participant who says 50% have developed this understanding and the other 50% have not and will go straight to specialists. And this preference for secondary care was explained by a lot of the participants in this study as being due to a lack of faith in the pre-existing poor quality primary healthcare system. And so this participant said, I think maybe gaining the trust with primary healthcare, that's important. And I couldn't agree with that more. I think that it's really important that we ensure that we build trust with patients so that they are convinced in this system and understand the benefits and importance of it to make sure that they're utilizing it as appropriately as possible. And I think this takes us on really nicely to the second key theme, which was, the second sub-theme, which was the impact of costs on service use. So again, this was brought up by a lot of participants, and there was this idea that although, of course, it's very important to have affordable services that increase the accessibility of primary healthcare, there seems to be an abuse of primary healthcare services because of the completely free system. And so this, as this participant said, because it's free, they like to get medication, come to the dispensary and see themselves, measure their blood pressure and get themselves checked up. And so there was this idea that patients are using primary healthcare services because they're available rather than because they need them. And so I think this is something that needs more research in to understand the reasons why it's happening and possible solutions that are appropriate in this context. Finally, the last key theme that we had was the health workforce. And again, within this, there was 3 sub-themes. So changing attitudes towards primary healthcare system was discussed by 11 participants. And there was a general consensus that because the NGOs have introduced primary healthcare services in Northwest Syria, healthcare workers are being exposed to primary healthcare a lot more, and so they're almost forced to see its use and its benefit in the system. And so there's an identification now of the importance of primary healthcare primarily as a triage system for secondary care. And as this participant said, I think right now specialized healthcare professionals recognize the importance of primary healthcare, otherwise they would be overwhelmed. So it's this idea that it's important because it allows us to triage who is being seen in secondary care. And I think this is a really positive change that we can definitely build on moving forwards. One of the really important things that we were looking at when we started this study was the impression of primary healthcare physicians amongst healthcare workers. And across the board, everyone that I interviewed agreed that there has been a long-standing negative attitude towards primary healthcare physicians in Syria. And as this participant put it, primary healthcare to us was taught as a specialty that had the lowest grades. The person that didn't get any other specialty in matching would get primary healthcare. And so this is a real shame. This is a very negative attitude towards primary healthcare, and something that definitely needs to be addressed if we want our undergraduates to be pursuing specialty training in primary healthcare, and our junior doctors to look at this field as something that they would ideally work in themselves in future. The importance of training for healthcare workers, again, was discussed by the majority of participants. And as this participant put it, the staff need training. There needs to be retraining and monitoring systems. So participants really highlighted the importance of capacity building amongst healthcare workers working in primary healthcare, but especially the idea that there needs to be monitoring after these training sessions have been done to ensure that learning is actually being put into practice, and that this development is sustainable moving forward. So in conclusion, attitudes, I think we can say that attitudes in Syria are changing towards primary healthcare. However, we definitely need to ensure that we're addressing the issues within the system itself to make sure that this change it continues, and that we can actually develop a sustainable primary healthcare system moving forward. So some of the main issues I think that came up from these interviews were the issues around health system governance, the need to increase public education and participation, to increase buy-in from public and improve utilization of services, and increase the importance of increasing primary healthcare teaching and training, so that those working in the primary healthcare service are providing the best possible care that they can be. Unfortunately, one of the things that I think we were not able to do because of time limitations and ethical considerations was to talk to patients themselves. And so it would be really useful for future research to look at interviewing patients and understanding their perspectives, to see how we can tailor public education to improve utilization of these services in future. So thank you very much for listening, and I'd just like to thank my supervisors and everyone who was involved in this research project, as well as all the participants of this study.